Imagine waking up feeling energized, balanced, and truly alive. I'm Dr. Richard Nkwenti, and at Pharmaprodia Compounding Pharmacy, we're not just dispensing medications, we're unlocking your body's hidden potential. With over 2 decades in integrative medicine, including a master's in health sciences in integrative medicine and a PhD in integrative medicine, I've witnessed the transformative power of properly balanced hormones. As a fellow in anti-aging, metabolic, and functional medicine, I bring a unique, comprehensive approach to hormone therapy. But here's the secret: one size doesn't fit all. At Pharmaprodia, we're pioneers in natural bioidentical hormones, crafting bespoke prescriptions that work in harmony with your unique biochemistry. It's not just science, it's an art form. Our patients don't just survive, they thrive. They rediscover vitality they thought was lost forever. But why take my word for it? I challenge you to tune into our podcast. Hear the stories of lives revolutionized. Discover cutting-edge advancements in hormone therapy that mainstream medicine isn't talking about. Are you ready to rewrite your health story? Visit www.pharmaprodia.com and take the first step towards the vibrant life you deserve. At Pharmaprodia, we're not just balancing hormones, we're igniting lives. Your transformation begins now.
You've really been digging deep into bioidentical hormones, and let me tell you, it's a maze out there. So many big promises, so much jargon. Thankfully, we've got excerpts from this really interesting book on it, and some details on this pharmacy, Pharmaprodia, and their lead pharmacist, Dr. Richard Ngwenti. Think we can sort the hype from the hope.
Absolutely.
Yeah.
Let's dive in. It's definitely a topic that needs careful consideration, especially now with personalized medicine becoming more popular.
Totally. And that's something the book really emphasizes, this whole difference between natural bioidentical hormone therapy and synthetic hormones. It even says that even some doctors and nurses, healthcare providers, have trouble with it. Did you find that surprising?
Not really. Endocrinology is very complex, and there's a lot of, misinformation floating around. What I found really interesting was how the book stressed that bioidentical hormones are like structurally identical to what your body naturally produces.
Oh, interesting.
Yeah, it's not like some artificial thing. These molecules, they fit like a key in a lock. Your body recognizes them, you see. Synthetic hormones, they can't replicate that.
Okay, so that's a really important distinction. It's not just about replacing hormones, it's about giving your body what it knows. And the book argues this can lead to, some pretty big improvements, yeah. The part about brain function really caught my eye.
Right, the book talks about how, and this is key, bioidentical hormone therapy can really zero in on estrogen imbalances in the brain. That's potentially, it could be huge EE for memory, focus, all that, which I know is something on your radar.
Wow, if it's true, that is a game changer. And it's not just feeling sharp, right? The book seems to say it impacts energy, sleep, mood, even metabolism. It's like hormones are the conductor of your whole body's orchestra or something.
Great analogy. And the book, it actually backs this up with a ton of studies, a lot of them cited on PubMed.gov, so you can actually go check the research yourself.
That's reassuring for sure. Claims are one thing, but having the science to back it up, that's important. Were there any particular studies from it that jumped out at you?
Well, we don't have the full list, but it definitely emphasizes how bioidentical hormones could potentially help with so many things. We're talking, that fatigue, brain fog, mood swings, sleep problems, all those things you were just talking about.
Yeah.
Even touches on more serious stuff like chronic diseases and aging.
Wow, that's quite the range. Almost like they're saying it's not just a treatment, but like a key to a healthier you overall.
Exactly. And this is where that idea of integrative medicine comes in. The book hints at it. This idea that it's not just about taking a pill. It's about figuring out why your hormones are out of whack in the first place.
Mm-hmm.
So lifestyle changes, dealing with stress, maybe what you're eating, all that alongside actual hormone therapy.
Treating the whole person, not just symptoms. I like that. But let's be real. Even with the science, it does sound a bit too good to be true. There's got to be downsides, right? Does the book address that?
Oh, absolutely. And this is where having a good doctor, someone who really knows their stuff, is so important.
Mm-hmm.
The book really stresses personalized care. Hormone therapy isn't one size fits all. It warns against self-treating, and it really encourages talking to your doctor, bringing your own research and questions, having that open conversation.
Being your own health advocate, basically.
Exactly. You're your own best advocate.
Mm-hmm.
And speaking of making informed decisions, I think this is the perfect time to transition to Pharmaprodia, because they seem to be all about that personalized approach.
Okay, let's unpack that. What stood out to you about this pharmacy specifically?
Yeah, from everything I've seen, especially Dr. Nkwenti, really seem to get that whole personalized approach the book's talking about. It's not just like, here are some hormones, problem solved,
Right, exactly. And it shows in how they do things. Like they focus specifically on bioidentical hormones, and they even do compounding in-house.
Compounding means.
So they can actually make custom dosages, different formulations, really tailor it, which is like essential for that whole personalized idea.
It's like, what's that word? Bespoke.
Yeah.
Like getting a suit tailored, but for your hormones. And Dr. Quenti seems super into that.
Yeah.
What was it about his background that you found interesting?
Honestly, it's his commitment to integrative medicine. He's got a PhD in it, even studied under like a pioneer in the field, this guy, Dr. Andrew Hyman.
Wow, okay. Right. And then on top of that, he's got this fellowship, anti-aging, metabolic, and functional medicine. It really gives you this picture of someone who understands hormones aren't just this isolated thing. They're part of this whole, like, intricate system in your body.
So he's looking at the whole picture, not just numbers on a test. That's going to be reassuring, especially for patients who maybe haven't felt heard by other doctors. Was that something that came up in the reviews you saw?
Definitely. People constantly mention how thorough he is, how he genuinely wants to understand what's going on with them, takes the time to explain things so they get it, answers all their questions, even works directly with a regular doctor to make sure everyone's on the same page.
Really?
Yeah, that's kind of unusual. But it's great, that kind of collaborative approach.
It's like he's bridging that gap between like traditional medicine and a more holistic view. But okay, let's get real. Does it actually work? Did you see anything showing this personalized integrative approach is getting results?
That's where the patient testimonials get really interesting.
Yeah.
Now, obviously, everyone's different. Got to remember that. But there's this definite theme of positive change. People talking about feeling less tired, their mood swings getting better, even having success with weight management.
Interesting.
Of course, testimonials aren't, hard scientific data or anything.
Sure, sure.
But they do give you that anecdotal evidence that this approach can really make a difference.
It's like you were saying before, that whole web of systems. So makes sense that if you approach it in this way, more holistic, personalized, you'd see those ripples in other areas. Almost like Pharmaprodia is giving us a peek at the future of healthcare, where it's all about the individual.
And that's an exciting thought, moving away from this one-size-fits-all and towards a system that actually recognizes, like, you're unique. Your needs are unique. But it's not just on the doctors, right? Patients have to be involved too.
Absolutely. And that's something both the book and Pharmaprodia seem to be big on. This idea of informed consent. You're not just along for the ride, you're an active part of this whole journey.
Exactly. Asking questions, doing your own research, really advocating for what you need. And that's where having good information, like what we're talking about here, becomes so important.
It's about empowering yourself to make the best choices for you. So as we start wrapping up this deep dive, what would you say is the most important thing for our listener to take away, someone who's clearly interested in this whole bioidentical hormone thing?
Yeah.
So much to think about. We've gone through all the sciencey stuff about bioidentical hormones, looked at what Pharmaprodia is doing, how Dr. Quenti approaches it. It really feels like the future of healthcare is becoming more personal, putting people in the driver's seat. But for our listener out there, someone who's clearly interested in all this, what would you say is the biggest takeaway? What do they really need to walk away with?
At the end of the day, it's about being your own advocate. Don't just take anyone's word for it, not even ours. We wanted this deep dive to give you the information so you can have those real informed conversations with your doctor.
Ask the right questions, do your research. Ultimately, it's about making the choice that's best for you, your situation.
Exactly. This deep dive, it's like the starting point. Now, take what you've learned, talk to your doctor, and figure out the path that's right for you.
This has been such a fascinating deep dive with you. It's amazing how something as complicated as hormones can really come down to something so simple, taking charge of your own health. And hey, who knows, maybe for our listener, this is just the beginning. There's a whole world of information out there just waiting to be discovered. Sometimes all it takes is that one deep dive to spark that curiosity and get you started.